Aderemi. This edition of the news features flashback, a recap of some stories that made the headlines during the week. We are staying tonight with the story of the tragic passing of Chimamanda Adichie and Dr. Ivara Esege's 21-month-old son, as the family is calling for full investigation into the death of the boy. The Nigerian writer earlier today spoke publicly for the first time about the death of her young son, describing it as a series of medical failures at a private hospital in Lagos State. In a detailed account released recently, Ms. Adichie said her son, Nkanu, would still be alive but for an incident that occurred at Eurocare Hospital on the 6th of January after they were referred there by Atlantis Hospital. She said the medical team at Johns Hopkins Hospital in Baltimore was expecting her son and had requested diagnostic tests, including an MRI scan and a lumbar puncture. In her account, the writer alleged that her son was not properly monitored after sedation and that established medical protocols were not followed. She also raised concerns about the conduct of the anesthesiologist involved, describing it as criminally negligent. Eurocare Hospital has not responded to the allegations at the time of this report. Earlier on TVC News at 7, I spoke to the child's aunt, Dr. Anthea Esegenwandu, who is a dual board certified internal medicine physician with 30 years of global clinical experience in Nigeria and the United States. She insisted that the matter was a case of medical negligence and demanded justice for the little boy.
It's important to note that Nkanu was ill but stable for transfer to the United States as planned. He was taken to the MRI suites at Eurocare, where he received what we call moderate sedation. So he received IV medications to sedate him for the MRI procedure. Subsequent to that event, he was transferred by the anesthetist to the procedure room where he was going to have the spinal tap and lumbar puncture and central line placed, off oxygen, unmonitored. That was the first incident of negligence. For a baby who was unwell, brought in by ambulance from Atlantis on oxygen, standard clinical practice demands that such a baby is monitored continuously. Again, we recognize that it's a tragedy. He's not coming back. However, we don't want his death to be in vain. We will be petitioning the Medical and Dental Council of Nigeria to lay a formal petition. We will be following up on a thorough investigation to find out what exactly happened. I still don't have the medical records. I just have the verbal report from the doctors at the hospital, where I actually went in person to interview. We will be demanding reforms, systemic reforms at multiple levels, starting from policymakers, starting from the regulatory bodies, the licensing bodies, healthcare institutions, academic and non-academic, healthcare providers, and the general public. We are speaking up now for those who have no voice. We're speaking up for those who this may have happened to and had no outlets and had no means to share their story.